Autoimmune disorder is a condition that occurs when the immune system mistakenly attacks and destroys healthy body tissue. Now, there are more than 80 different types of autoimmune disorders, and a person may have more than one autoimmune disorder at the very same time. Well, we'll find some solutions today to make you feel better, because joining us with more details are Doctors Josh Red and Michael Gadway with Red River Health and Wellness. Great to have you both with us today. Welcome back. And of course, you are chiropractic physicians who specialize in certain autoimmune diseases. So let's explain what autoimmune disease is even in the first place.
Yeah, what this is, when your immune system, instead of attacking bad things like it should, it starts attacking its own tissue. In this case, there's, they'll name the autoimmune disease to whatever tissue it's attacking. So there's lots of different kinds and all that as well.
Okay, so yeah, because I think people just get a little bit concerned. Do they even have? They wouldn't even know what to look for.
Yeah, sometimes it's tough.
Yeah. So what autoimmune diseases do you see the most often in the office then?
The most common one is Hashimoto's, which is an autoimmune disease that attacks the thyroid tissue. But also we see rheumatoid arthritic patients. We see celiac patients. We see patients with Crohn's. We see patients with lupus. And the problem here is once you have an autoimmune disease, you're more likely to have other autoimmune diseases. So your body gets confused and starts attacking other tissue. And sometimes we'll have patients with 5 or 6 different autoimmune diseases. I mean, they're just a complete wreck when it comes to their health.
Well, and like I said, at the same time, you sometimes think, well, I have this, so I must not have that. But you can have them all at once, which is it's just kind of scary. Now, I think when we talk about these things, people are saying, well, how would I even know? What are some of the symptoms they should even look for if they think they may have autoimmune diseases?
Some of the symptoms, the first symptom that we find with our patients is they're exhausted all the time.
Okay.
No matter how much sleep they get, they don't wake refreshed, they have a hard time getting through their day, they push themselves through the day. Headaches, digestive issues, we find that as well.
Okay.
We find brain fog, anxiety, and depression. All these things, there are aches and pains in their muscles and joints. So there's a multitude of low-grade symptoms that just keep going forward.
And obviously, depending on which tissue in the body is being destroyed will depend on what other symptoms you're going to have as well.
Right.
Some patients will have tissues attacking the exocrine glands, which basically makes them so they can't cry or have saliva in their mouth. I mean, there's lots of different, whatever tissue is being destroyed, there'll be different symptoms.
Well, and I think if people are out there and they're saying, gosh, not only am I always tired, but I'm also this, that, and the other thing, and all the things that you've mentioned, they might be thinking, oh my gosh, what do I do now? So how do you deal with all of these conditions and all of these symptoms? What's the way to deal with them and treat them?
The big thing here is that you have to figure out what's causing the autoimmune disease to flare up. And this could be multiple physiological and hormonal imbalances, but at the same time, it could be something as simple as a couple of foods that cause it to flare up too.
Right.
So, we have to take that into account. So, and you can't cure these conditions, but what you can do is manage it immensely. And so we go in and do all the extensive tests.
Right.
We have a test that will check for 24 different autoimmune diseases. It's probably one of the best autoimmune tests in the world right now. It's awesome.
And how does that work?
They basically take your blood and they'll check for those antibodies for those certain tissues. But we'll do a lot of other medical tests and blood chemistry and things like that as well to figure out what's causing it to flare up, and then customize a treatment plan for that specific patient to help get them better and help them feel better.
Yeah. And I think it's comforting when you do these tests. I mean, I went and had blood tests done, and I think when you do that process of elimination and you say, okay, well, let's see if it's this, or whatever it is, and you go and you get these tests and you come back, you say, okay, well, at least we know it's not this, at least we know it's not that. And it does comfort somebody, but then when you take the things that they maybe have to deal with, you find a way to manage. And I want to get back to that point you just said, because it's not about curing, it's about managing. And so we don't want people to be afraid that just because they find out that perhaps they do have an autoimmune disease, that they can't manage it and live a healthy lifestyle. So what would you recommend as far as management?
The first thing to remember is not to let someone else tell you how you should feel.
Okay,
If you don't feel well and you've been to doctor after doctor or healthcare provider after healthcare provider and they say to you, it's all in your head, or quit eating so much, or exercise more, and you're exhausted and you can't exercise more and you're not eating, remember to not give up. You want to go find someone who knows what they're doing, and that's what we are experts in. So we take our patients, and many of them have been to other doctors for decades, sometimes as long as 20 years, not being able to find the solution, and they come to us, and we can change that profile for them.
And not to be afraid of that, and don't be afraid of finding things out and making some different changes in your life. And some of the changes you recommend include things like different vitamins.
We have different evidence-based nutrition that we use to help kind of restore or improve physiological function to those imbalances. We'll have different dietary changes, but they're more specific to each person, because you might have different food intolerances as someone like us, right? So everyone's a little bit different, and we want to just stop treating symptoms. We want to start figuring out what is the mechanism behind all these problems and get to the mechanism you know, and that's the best way to get these patients function a lot better.
Sure. And when you deal with a lot of this management and a lot of these treatments, what are some of the results that people can expect?
The results we see are awesome. You know, you can't cure it, but we can get these patients that have, you know, 0 to 5 good days, and we can get them to where they have 20 to 25 good days, you know?
It's a big difference.
And then the big thing is to where we can teach them and educate them and show them how to be the expert in their own health and kind of manage their condition more efficiently and what to do to keep things in check and all that stuff as well. So.
Now that said, I want to just ask a practical question, because I know there are people out there that do have, I mean, we have crazy schedules, you know, and there are people who are managing everything from their economic situation to their job to their children. So should they be alarmed to think that perhaps they have something wrong if they're tired all the time, or should they just chalk it up to the typical lifestyle that they're leading?
I don't think either. They shouldn't be alarmed.
Okay.
There's no reason to be afraid. But at the same time, don't blame something else, because you know how you should feel.
That's a good point.
And no matter how hard you work or if you're not feeling right, you need to listen to that and take action.
That's a great tip. That's good advice. And I know a lot of people want to be able to have that one-on-one talk with you and get that kind of consultation time. How can viewers reach you?
Yeah, they can go into our website at redriverhealthandwellness.com. They can call us for a free consultation as well at 505-247-1000. You know, and that's something, if you don't know if you might, you know, we'll tell you if we can help you or not. I mean, if we can't help you, we might send you to a different place that can help you. I mean,
absolutely.
You know, but the odds are, if you're struggling with these chronic conditions or chronic autoimmune responses or diseases, you know, there's something that we can do to kind of help manage it a lot more efficiently.
Yeah, and speaking from experience, you really take the time, and that's the thing. That's what people want. They want to be able to have somebody to just talk to them and answer questions that maybe you hear 25 times a day, but you don't make somebody feel uncomfortable asking, because we don't know those things as well as you do. So it's nice to have you there and to answer and to give your time and your expertise as well.
Exactly.
Really. Thank you guys so much.
Thanks for having us.
Thank you,
And we'll
Nikki.
look forward to the next time you're here to help us out with our health.
Thank you. Appreciate
and
it.
Here's the question of the day. Are you ready for some football? After the break, we have tailgating tips that give your friends something to cheer about. Come on, Giants. I gotta pick it up. That's